All right, everyone. We're here with Juan Pablo Cappello, the co-founder and CEO of Nue Life, which is a ketamine sort of clinic, but kind of like a next generation ketamine clinic that has interesting like online offerings. I don't know. Maybe I should let Juan Pablo describe what exactly Nue Life is. But Juan Pablo, thank you so much for taking the time to speak with me this morning. I really appreciate it.
Well, no, thanks. Here it's a chilly day in Colorado, so happy happy to be connecting. Yeah, so we're a next gen mental wellness company that's leveraging emerging digital and medicinal technologies to drive better patient outcomes. And with that little summary, you'll notice I don't talk about ketamine, I don't talk about psychedelics, not because I'm afraid to lean into those spaces, but because the philosophy of the company is really around driving extraordinary patient outcomes. And the only way to do that's through metrics and analytics. And that's really what we believe, sets our approach apart. And we believe, but now we're in the process of demonstrating that ketamine psychedelics are an important piece to drive those extraordinary patient outcomes.
Gotcha. So digital data metrics first, psychedelic sort of like as a in service of those things. That makes sense.
It,
Yeah,
exactly.
and I mean, just out of curiosity, everyone that ends up running a company like this usually has an interesting backstory. Like, what were you doing before starting Nue Life, and what was sort of the story of Nue Life getting started? Like, how did it come to be?
Yeah, like a lot of these stories, it starts with my grandmother. I grew up in Chile. My mother's American, ran off to Chile quite young, dropped out of college, pregnant with me, and went to one of the most left-leaning countries in Latin America in 1966. By 1973, we had a military coup, and things were very rough, especially with people with the kind of politics that my parents had. And so I spent a lot of time in the care of my grandmother, and she was part mestizo, Native American, and began exposing me to those traditions. And so I had this very interesting upbringing where my mother raised me, as a Quaker, taught Ashtanga yoga and TM in the 70s. And then my grandmother was exposing me to these native traditions. And in Chile, the desert is called Atacama, but a lot of people, it's the driest desert in the world. Some of the best telescopes in the world are there. But what a lot of people don't realize is that it's actually called San Pedro de Atacama. And as you and many of your listeners will know, San Pedro is one of the, along with peyote and ayahuasca and psilocybin, are really, sort of the four medicines that the native people of the South and the North of the Americas experience. So I had actually, a bit like you, been in financial services. I built the first fintech in Latin America, mainly because my grandmother, when we were a kid, she'd get about a $70 biweekly pension check, and we had to go wait in a hour and a half line to pick up the check. Then she'd buy me an ice cream, and then we'd have to spend 2 hours to deposit the check. So our whole day was basically riding the bus, waiting in lines, getting an ice cream, and getting home with $68 in her pocket. And we built the first fintech trying to leverage technology to help people like my grandmother. We failed miserably, sold that company for about 700 million, but didn't change anyone's lives. That didn't feel great. That was about 20 years ago. And so just really thinking about how at this moment we could try to change the paradigm around mental health, and sort of, respect the, the sort of insights that my grandmother shared with me from the native traditions and bring that to a more Western model. And so that's really the backstory. So, tech, fintech, sort of most of my career building companies, and then trying to take that sort of discipline to build a really next gen kind of company in this space.
Gotcha. Yeah, I don't know too many people that have had like Quaker and, psychedelic medicine at the same time. That's a very interesting blend, the most
Well, let
Quaker
me tell
there
you, at a
is the
lot of
oatmeal.
Quaker meetings in the 70s and 80s, that was they were sort of the holdouts of the defending the faith of the 60s psychedelics. Timothy Leary, Alan Watts,
Really?
Ram Dass. Yeah. No, you'd go if you were going to Esalen in the 70s and 80s, as we would pop in every now and again. Yeah, there were a lot of Quakers.
Okay. I did learn something new every day, I guess. Wow. Um, so when you decided that you wanted to start a company around mental health, was psychedelics kind of like the first thing that popped up, or did that kind of come later?
Well, it's interesting. So this company really was launched with a thought experiment, and this may actually address sort of a lot of the why this approach that some of your listeners or you might have, which was coming out of COVID. Um, you know, the statistics around mental health, this is not a pun, are just very depressing, right? They're 1 out of 5 women over 40 before COVID are taking an antidepressant on any given day to get through the day. We have 1 million veterans committing suicide on disability for PTSD and treatment-resistant depression. Million that costs the government direct costs about 30 billion a year, leaving aside all of the costs of the suffering. 17 to 22 veterans committing suicide every day, and on, right? And that's all before COVID. So here we are coming out of COVID. Everyone I know has been affected negatively, in terms of their mental wellness. And the question is, how could we help 1 million people before psilocybin becomes legal? So just think about that. If my mom always said, the quality of your life is in direct proportion to the quality of the questions you're willing to ask yourself. So ask yourself better, harder questions, and you're going to hopefully come up with, better answers and a more fulfilling life. And so for us, we just really look, I started a Native American church in South Florida years ago, and I love that container. The plant medicine, indigenous, container. But I start thinking, okay, can I scale that container to help 1 million people? Unfortunately, because of government prejudice and restrict, I should be able to, but the reality is I can't. So then you start saying, okay, psilocybin, 3 to 5 years, and how do we help 1 million people, end their suffering or heal their suffering between now and then? And then you just start, okay, I have to go with the medicinal model. What tools do I have available? Ketamine. How do I make those tools more accessible? The average cost of ketamine infusion therapy and intramuscular, $700 to $1,200 per treatment, not including the follow-up care. So I start saying, okay, how do we drop those costs 80%? Leveraging technology, telemedicine, lots of things we can talk about. And so that was really the question we ask ourselves, and that's really how we began to frame the company we wanted to build. So it was much more thinking about the impact and then reverse engineering, how do you get there, as opposed to hey, I sat in ceremony and I got hit by this bolt of lightning, and now I'm the Messiah because I have this knowledge to share, right? Which is the origin
Met a few of
story we
those
hear a
guys.
lot of.
Uh-huh. Yeah, I think that you're totally right. Like when you look at what's actually available now, if you're trying to make an impact now, models similar to what you're doing are, kind of the only option, unfortunately. Hopefully that will change, in the future. But yeah,
Well,
you do you do
I
what
think
you
it's
can with
very,
what you have at the moment, right?
yeah, it's sort of, you go to war with the army you have, not the army you wish you had. Though I'm very grateful to people like you who are, funding the work around novel compounds, because I absolutely do believe in a quote I've heard you and other people use, which is, the psychedelic that is, most doing the most good in 5 or 10 years may not have even been invented yet.
Yeah, I
It
think
may
that's
just
probably
be it
true.
may just be in a lab. And
Yeah,
so, I really recognize that work, but you know,
that's a long
if
time
we if
from now.
right,
Yeah.
if we think about Ram Dass and Be Here Now, let's there's some suffering here now, and how do we how do we start addressing the root cause of that suffering? And that's really what our company is all about.
Yeah, for sure. The novel compound thing will definitely be huge, but like you said, very far away. Although I think that it's funny, people sometimes forget that things like ketamine and LSD and MDMA were invented by humans. They've been around for so long, we almost just sort of like take them for granted. But like at one
Right.
point, those were novel compounds, and they were invented like in some cases almost 100 years ago, which is kind of crazy.
Yeah.
So
Well, and the
so
other thing is when you think
yeah.
about, sorry, just, and I know this is something that's near and dear to your heart. Yeah. And if you think about that, many of the classic psychedelics were invented sort of by the same people too. So that also is interesting. Sorry, I interrupted you.
Yeah, no, and it's a good point. And you got to think that as more people get involved in the space with, different, like more diverse backgrounds, they may be able to come up with things that are very, very different from what we have now. Although it'll be hard to replace mushrooms. But so the model now for Nue Life is it's telemedicine based, right? And you're not using obviously like ketamine infusions. Is it all oral lozenges? Is that kind of the
Hmm.
idea? Okay.
Yeah.
So
So
maybe,
we
yeah, just like maybe kind of walk me through sort of like what the actual product is and like what it's like for a patient to come to Nue
Mhm.
Life and like what happens to the patient when they come in.
Sure. So um, we spent about a year collaborating on how to really, change the model around mental health, right? And so I think this will resonate. I'll be really quick about the first part, but for a lot of your listeners, I think they've realized that anxiety, depression, and PTSD are just description of symptoms. They aren't descriptions of any root cause of anything. So it's similar to if you go to your doctor, you have a broken leg, and he or she diagnoses that as extreme pain in the lower extremity. Let's address the pain, right? That's the broken model of our current mental wellness system. At least when it comes to the prescribing of antidepressants, which prescriptions have doubled over the last 8 years. So we began thinking, okay, how can we start trying to address the root cause rather than masking the symptoms? People who are familiar with psychedelics and have had those kind of experiences, this will resonate with. So again, start off thinking, how do we safely, effectively, and ethically lower the cost of existing technologies 80% to make it more accessible? Why is accessibility important to me? Because I want to help a million people. But also, if you think about the communities in most traumatized, most in need, whether it's the urban poor, veterans, indigenous people, the ability to pay is very limited, right? So our company, by the way, started 100% founding team, people of color and women. We're a public benefits corp. So, we right from the beginning, really focus on the social mission. So we've developed, yeah, thank you. We've developed an app which creates. It's not just about delivering the ketamine and that experience in a safe, effective, and ethical way, but it's about providing aftercare, community, and connection as well, right? Because we actually don't believe that psychedelics generally, whether it's ketamine, MDMA, psilocybin, et cetera, actually heal people. I always say, listen, I've been sitting in ceremonies since I was very, very young. And some of those people that I've sat with dozens, if not, hundreds of times are still assholes. So I don't really, I don't come to this as, hey, this is a panacea. I come to this that psychedelics, ketamine, et cetera, are amazing tools to help people reboot and reset. And what's important is what happens afterwards, right? Because that's a moment in time. And the reality is, with most of these experiences, a lot of people don't fundamentally change over time. And that's, I think, because there isn't the appropriate integration and aftercare. So what we've done is we've created an app where you can do there's some screening. We're beginning to add sort of personality quizzes. So people, whether or not they engage on the medicinal side, can begin to have a sense of who they are. If you know yourself better, you're likely to make some better decisions. So understand your behaviors, your motivators, and your goals. We begin to use that as a way to, sort of help screen people. If it makes sense, you have a teleconsult with the physician. A small percentage, well under 50% and often under 20% of people who get that consult are appropriate candidates for our ketamine therapy, but we really view it increasingly as a mental wellness program. Right now, we have a 1 month and 4 month mental wellness program. Early into 2022, it's going to be a 6 month mental wellness program. And then, we through telemedicine and a telepharmacy, 1 dose of ketamine gets delivered to the patient's house to start with the drug discovery to figure out what the dosing should be. We, monitor the whole experience through the app. We're offering, a telesitter, though everyone needs to have a physical sitter with them. There's a, sort of an emergency button on the app. If you need, there's stress during the experience, we can talk about what our results have shown. We have a music, we have sort of our own music player, voice journaling, instructional videos, mood tracking, and then offering, therapy and integration work after. We're, for instance, taking the protocols designed by our friends at Psychedelics Today, digitizing them onto the app. We've already, sort of updated their integration handbook to make it appropriate for ketamine, et cetera. So we really, our goal is, and this is the challenge I've given the team, what's the least amount of ketamine we can use to help people have these transformative experiences to reboot and reset? And how do we leverage technology to keep people in that elevated state? So hopefully they never have to do ketamine again. If they find it interesting and worthwhile, sure. But we're really challenging ourselves to come up with a model based on healing, not a model where, we basically, it's like yo-yo dieting, where we help people, sort of lose weight, get fit, over the course of the first month where they're doing 3 to 6 ketamine experiences. And then we let them sort of crash and burn slowly over the next 3 months. And then, they come back to us and, we help them feel better again. I think that's a very unethical business model, which unfortunately a lot of people in the ketamine space have adopted. And, we're trying to, zig where a lot of people in the industry are zagging, unfortunately, by the economic incentives that they've created.
Yeah, the economic incentives are definitely like a little perverse, right? Obviously, you make more money if you can keep selling people more ketamine. So it's like, and that's why I think it's kind of cool that you're a public benefit corporation, right? Because you're allowed to make that decision to like actually like change people rather than just only focus on the profit side of things. And you're totally right that, oftentimes, while you're doing the psychedelic experience, you feel like you might be healed or whatever. But I think the truth is a lot of these mental health issues, especially things like depression, are often just caused by like environmental factors. And like if you don't change those environmental factors, like your depression or whatever is not going to go away, right? And so the psychedelics might be a great catalyst for you to realize you need to like make a change or something, but making change is very hard. And so you sort of mentioned community aspect and like the ongoing support to help people actually make those changes is pretty critical, I think, if you're actually trying to help people, which sounds like you guys are. So I think that's, it sounds like you're thinking about it the right way from my perspective anyway. But one thing I'm curious about though, go ahead.
One thing I wanted to mention there is, so, you have to, unfortunately, and this is where, sometimes in this space, right, we can often be, sort of closed-minded about, sort of incremental improvement, right? The same way, I wish I lived in a world where I could help 1 million people through the Native American church model, right? And for me, that's one of the most healing containers sort of out there. But unfortunately, that's not available to me. Same thing even with this company. We're very, very clear where we're taking this company. But the reality is we have to build it. We had to build it in stages, right? And so we launched in 2021. Our goal was to help 1,000 patients the first year, mainly through the ketamine, and then learn how to do the integration work, sort of as we learn to facilitate the ketamine experiences, we were able to help over 2,000 patients and capture all of that data. And now really our challenge as we go into, and we were in 5 states, now we're rolling out into 10 other states, including New York, this week or next week. And so, the whole idea is we're moving from a more ketamine centric company to, over the next couple of months, to a company really focused on this integration, community, and connection that comes after the ketamine experiences. But again, I like to be very clear, sort of about where we're headed, but also very honest about where we are, because it's a journey. It's a journey of healing. It's a journey of building, the technologies to really, drive these extraordinary patient outcomes. But I'm super proud of the work the team's accomplished over the first year, and the data that we've collected is really almost jaw dropping.
Well, I have to ask then. What is the data showing? What is the what are you learning about how patients respond to ketamine and how this stuff helps?
Yeah. So my co-founder ran the Knowledge Graph Group at Accenture, and then at another consulting shop, the AI and Big Data Group. And so, what we have a unique expertise in is really capturing data, and knowledge graphs are the way big tech companies like Netflix and Amazon sort of visually interact and analyze the data that they're receiving, right, in order to make recommendations about what to buy or what to show you, et cetera. And so we sort of felt like, hey, could we take, that same approach and technology to gather data, but not to, sell you stuff or, make you feel bad on your Instagram feed, but really, sort of try to elevate people. And so we've captured the data on about 2,000 patients. We're publishing data on the hardest patients, which are the treatment-resistant patients. So we've treated 650 treatment-resistant patients. That means that they've tried 3 antidepressants and talk therapy and haven't had, relief of their depression, anxiety, or anxiety. And so those 650 patients, what we've found is, so those are the hardest patients that Western medicine has like no more bullets for. And what we've been able to show is with 3 ketamine experiences, over 50% of those patients have a 50% or greater cessation in symptoms. 50% or greater cessation in symptoms, that's what's considered clinically significant, and that's sort of the gold standard. So with 3 ketamine experiences for a total cost of about $700, 50% of those patients are able to significantly alleviate their suffering. When patients do the full course of treatment, 6 therapies, ketamine experiences, that number goes up into the mid 60s. And we have this data that we're putting out there. Again, the big challenge of this industry is that many patients, many of those people who 15, 30, 45 days out are doing quite well. Again, if there isn't a lot of work being done, deep work being done, where the question is where they're going to be in 90 or 180 days. And we're measuring that as well. And what we're all about is, how do we keep those people through things like digital phenotyping, getting passive data, from what they're doing, that's being captured all the time by their devices, whether it's Whoop or an Aurora Ring or an Apple Watch or even their phone. How can we help those people stay in that elevated state? But yeah, these results that we're publishing, and they should be published in the scientific journal by January, are just really should make a lot of medical practitioners who feel like they don't have a tool better than antidepressants realize that there are much better tools out there.
Yeah. And that study that's going to be published in January, will that sort of show like what those rates are at the 45-day, 90-day, 180-day marks as well?
That's going to be a follow-up study. So we're capturing all that, and this is where we're super honest. If the data shows that our patients are reverting back, well, then we have to get better with our protocols and and do a better job of managing those patients. I mean, what I believe in this industry is, there's a lot of this sort of, psychedelic exceptionalism, right? People came to these medicines, they were transformative for them. And it's almost that they don't feel they need to be really held too accountable, for the results. It's like they know these are safe and effective and can change the world. So let's just effing get to it, And our view is we share that belief, but the way we're going to really actually advance this conversation outside of the bubble. So people, we have to accept that 85-90% of people in this country, their minds have been victims of the drug war, and they've been taught that these compounds are, dangerous and just dangerous, and that terrible things can come. And, more mainstream use is a very, dangerous experiment that, is being, pushed by, a fringe element in society. And so our view is the way we have to start by, providing really uncontrovertible data that shows that these therapies are safe and effective. And then work with incredible spokespeople like the veterans community and the urban poor and the people who have been, the most victimized groups of the drug war, to really, start having a conversation, a much more, informed conversation about the safety and efficacy of these compounds. And that's where, we think, we know that, the way you start is by having sort of unassailable data that demonstrates what we believe to be the case.
Yeah, data absolutely is important. One of the things that drives me crazy, this comes up a lot around when people talk about microdosing, is, I'll ask just what are the studies that support it? And people will just kind of give you this answer that's like, well, hey, if it's helping people, it doesn't really matter what the data says. And it's like, well, the whole point of the data is to know if it's actually helping people or not. Oh yeah, people. Yeah, it's weird. It's weird. So I'm curious though.
And then people also in microdosing. Sorry to interrupt, but people ignore the data. I mean, in high dose psychedelics, the data is very, very consistent. Unfortunately, around microdosing, and what just time will tell, and it'll play out. And I think what we're going to find is, that mental suffering and the issues that people are trying to address with microdosing are so varied, we shouldn't be surprised that they might work well for a certain cohort of people with a certain kind of challenge they're trying to face, but not for other people. But yeah, then people ignore, and there's plenty of studies that suggest that microdosing might not be particularly helpful. But
it's definitely mixed. So, getting back to data, those numbers that you were talking about with the drop off, 50% of people having, symptom cessation after like 3 sessions. What is that like right after the last session? Is that like, what is the timeline for those data points that you were talking about?
About 15 to 30 days.
Okay.
With your typical, and one of the things that we're moving towards, I mentioned digital phenotyping. That's just a fancy word for capturing passive data, right? So, we're already integrated with the Apple Watch and your Apple device and the Whoop, and we're integrating with the Aurora Ring and some of your other wearables soon. But it's interesting because the way to date, we're in psychology and psychiatry, they're capturing, data is asking patients questions, how they feel, just, sort of questionnaires. But the problem is, is that, when you ask somebody a question, you have to ask yourself, how reliable is the answer, right? And so what we're beginning to do is if patients allow us to integrate the app with, this data, which is already being captured and is being used by Apple and Google and Facebook and other companies. If they give us access to that data, then what we're able to start seeing is comparing and confirming what the patient's telling us about their mood and their mood tracking, et cetera, with what we're seeing with, say how much they're sleeping, how much they're exercising, how they're interacting with their phone, to see if what they're self-reporting is consistent with what we're seeing. Because the other thing, as I said, I'm very interested in not allowing patients to, sort of crash and burn and spiral downwards without us trying to intervene. And so if you think about it, if the algorithms and the AI in our app see that somebody did the experiences, were self-reporting that they were doing well, were sleeping X amount, exercising a reasonable amount, and interacting with their phone in a certain way. If suddenly the algorithm or the AI sees that the patient is sleeping less, stopped exercising, and is now interacting with their phone in a way that suggests they might be depressed or anxious, we don't have to wait till the patient reaches out to us, back in a dark place 3 months from now. We can actually proactively reach out to the patient, and it doesn't have to be creepy. It doesn't have to be, hey, we noticed you didn't sleep well the last 3 nights. It can be as simple as, hey, this might be a great week to do another therapy session, or here's a 50% off coupon for a therapy session. Or, hey, we all have up and down weeks. Here's, why don't we review your last ketamine experience that you found was so helpful? Here's the playlist that you used during that experience. Here's the intention that you helped set. Here are the notes that you wrote after the experience. Why don't you spend a little time today or tomorrow trying to reconnect with that experience? So there's a lot of things we can do by capturing data to really help, keep people in the elevated state. Again, it's a little bit, if you analogize it to weight loss, we have a lot of people doing sort of yo-yo dieting. It's almost as if you had an app that could, see that somebody's reaching for, the bag of cookies for the third time today, and then, try to sort of suggest some other behavior, right?
Yeah.
In
Well,
a proactive
I think this
way.
is this is very interesting and important, because I do think that just sort of the nature of this sort of thing is that people often wait until they're almost at like the proverbial rock bottom before doing anything. And being at rock bottom really sucks. So if you can keep people from getting there, that's huge.
Well, and when you're at rock bottom, you're in a hole, and we all know digging out
Right.
of a hole.
And you don't reach out. It's very hard. Yeah. So,
yeah. And so after you.
yeah, I was going to ask another question, but if you wanted to go on that for a minute.
No. After you.
Cool. So, yeah, this is all very interesting. I think one of my big questions around this sort of business model is, there are other companies that are doing similar things. Like, I've interviewed Mind Bloom on this podcast, and
Sure.
Ketamine, at the end of the day, it's a molecule that's kind of a commodity at this point. So how do you really differentiate yourself and, not fall into, commodity pricing, race to the bottom type things, and actually really have some sort of competitive advantage in a business sort of like this?
So again, as a public benefits corp, we're very focused on sort of the social impact. And so my view is, if we can commoditize healing, deep healing, in a safe, ethical, and effective way, I'm very happy for that, for lots of companies to, use our protocols, learn from what we're doing. And I don't even view them as competitors. I view them as, it's almost like if you're a shaman, I don't think you view other shaman who are helping people heal as competitors, right? You just view each other as brothers in a shared mission. Unfortunately, in the ketamine space today, I say, look at people's business model, and you will understand, where they're headed. And there's unfortunately too many companies in this space who ultimately their reoccurring revenue model is based on more ketamine. Our reoccurring, and again, just for people who maybe don't understand sort of the valuation game, $1 of revenues, regular revenues, is worth $1. As soon as you turn $1 of revenues into reoccurring revenues, now that is worth, between 5 and 10x, right? And so literally you can have a company that's worth $10 million if you're, selling ketamine or whatever. But as soon as it becomes a subscription model, you're the Dollar Shave Club of ketamine. Now you're worth $100 million, right? And so the first question anyone who has a ketamine kind of project, and this is going to be the same thing for MDMA and psilocybin, et cetera, is how do we turn this into a reoccurring revenue model? And the person who's asking that question doesn't give a fuck about, the impact. They care about the dollars and cents, right? So, we're asking ourselves a different question. How do you heal people, and how do you create a reoccurring revenue model that isn't based around ketamine? Our reoccurring revenue model is going to be a mental wellness club. So essentially 6 months, you sign up for our treatments. Where we're headed is you get a 6-month mental wellness program. The first month or so is focused on these transformative ketamine experiences, hopefully eventually MDMA and psilocybin. And then the next 5 months is about integrating those experiences, having you on the digital platform, and trying to keep you in that elevated state through the different modalities that I mentioned. After the 6 months, you're no longer a patient. It's almost like you've graduated, at least for now, from the medicinal model. And now you're just on our digital platform as a member, and you're allowing the algorithm and, your group therapy and your cohorts, et cetera, to sort of keep you in that elevated place over time. And obviously the cost for that, now we're talking, whether it's $20, $50, $100 a month to help keep you in that elevated state. So hopefully you're never in a place where you're back in a deep hole where you need, ketamine, psilocybin, or MDMA to help pull you out. So that's really, how we're creating. Because again, I always say, it's like in tech, what gets measured is what gets done, right? What gets acted on. And so again, I just encourage people to look at the revenue business models of people in the space, and that'll give you a very clear insight of where the incentives are, and where the incentives are, unfortunately, is where people are headed.
Yeah, and when you were talking about recurring revenues, and obviously one of the best ways to get recurring revenues is to get someone addicted to your product. And one of the potential ugly downsides of ketamine is that for some people it does seem to be an addictive substance. I certainly know people that are addicted to ketamine recreationally.
Yeah.
And
Yeah. Let me.
so I'm kind of curious to like what your take is. Like, have you ever seen people, get addicted to ketamine after going through one of these programs? Are there screening questions you can ask to make
Yeah.
sure people that have a, high propensity for that do not partake?
Yeah. So a couple of things there. So I find it shocking that at this stage, as a CEO of a ketamine company, to say, or company that uses ketamine, to say that, yes, we work from the assumption that ketamine is addictive is controversial at all. I think everyone in this space, again, that it's certainly not as addictive as a lot of things. There's even a debate as to for who it could be addictive for. But I think, everyone in the space needs to just work from the base assumption, whether it proves to be true in every case or not, that we're working with a potentially addictive substance. And with the ketamine mists, which are sort of a chill pill in a nasal spray, there's lots of people who get addicted to that because it's just so easy and accessible. So we've facilitated 17,000 ketamine experiences, and we've captured the data on most of those experiences. So, when people, and I fully understand, express a concern around the at-home model, I say I share that same concern. I'm focused on accessibility. I'm trying to get the cost down 80%. And this is a model that I sort of felt we needed to adopt. But before we adopt, or as we adopted that model, we began capturing data. And what we're showing is 17,000 experiences. EMS was only called once, has only needed to be called once. 17,000 experiences. EMS was called once, no serious negative outcome. And that patient actually found the experience so helpful, he tried to sign up again the following week, even though we had discharged him. So that gives you a sense of, there was some anxiety. The person, grossly misrepresented their medical history. So what we're doing is, yes, we have a lot of screening questions, but also by capturing the data and tracking our patients very, very closely, the algorithm is actually making us better at screening patients than, we would be if we weren't capturing the data. So it's almost like, the way, in technology, the idea is that, the version 1.0 is pretty good. Then you have version 1.1, which is taking out the bugs and fixing things. But then by version 3, 4, and 5, you realize there's been a real improvement in how you're delivering the service. Well, same thing with what we're trying to do in terms of keeping this as safe an experience as possible. Ketamine's inherently quite safe, albeit potentially addictive. And so, we're by capturing data, we're getting better at screening patients. We haven't had, the reality is you can get things that are alleged to be ketamine on the street for $20. Why is somebody going to pay $200 to $250 to if they're using this as a drug of abuse? But notwithstanding that, we have to be very cautious and respectful of this tool. And also a little bit like Alan Watts, said, hey, once you've spoken to God, you don't have to keep calling him or her back, right? Like, listen, pay attention, do the work, and, maybe check in every couple of years. And that's how we feel with the ketamine, that, in those 3 to 6 transformative experiences the first month, you're talking with God. Spoiler alert, that's you. And, the question is, how do we, do enough healing so people don't feel like they have to keep going back to that well over and over again?
Yeah. And I also think that, at the beginning of this conversation, you talked about the goals of, over time, getting the cost as low as possible. And I actually think that may be a key to prevent people from getting addicted. Because like right now, what happens is, as you sort of mentioned, like the cost of, doing the Nue Life or the mind bloom therapy is much more expensive than buying, like a bag of ketamine on the street, right? And so the concern is, and I've actually seen this happen with some people, is they do, like a mind bloom session or something. And then they're like, well, that was great. I want to do that again, but I don't really want to pay like $500. So I'm just going to go to my friend who I know has ketamine. Now, instead of having a single dose lozenge, they have like hundreds of doses in this bag, right? And then they just kind of overdo it. And all of a sudden they like ketamine a little too much. And then but if you actually like close the differential between, like the actual medically supervised, medically available ketamine and the street ketamine, people have less incentive to go to, that unregulated market and, end up getting, potentially addicted. So I think that the lowering the cost probably like helps prevent some of the addictive tendencies as well.
Well, the main thing, let me just speak to that, because my view, I totally agree with what you just said, Ron, but I also would point out that by providing the aftercare and tracking patients, yes, look, unfortunately at scale, right, you're going to have some negative outcomes. And, some people, just because of the trauma, the suffering, the way they're wired, you're just not going to be able to reach, and they're going to make extraordinarily bad decisions, right? And unfortunately, we can't solve for that 100%. But by leveraging technology and knowing our patients well, hopefully, if and when one of those kinds of outcomes begins to occur, we're able to, in the most, ethical way possible, try to intervene as much as we can as the medical providers. You see, so just by providing the aftercare and trying to, help patients heal, because that's the thing. Sure, I agree. If you give somebody ketamine or any, intense psychedelic experience, and then you just send them on their way, a lot of people are going to be disoriented. It can be an ungrounding experience that actually makes people somewhat worse rather than better. And then, people may make bad decisions and start chasing those rainbows. On the other hand, that's why we're, building out this 6-month mental wellness program, so that we'll be offering each and every one of our patients, 4 to 5 months of integration, and that hopefully will keep some of those people that might have, you know, made some of those bad decisions, actually heal the root cause of their trauma, and avoid, being in that place of pain, and suffering, which is driving those negative decisions.
Yeah, I totally agree that the aftercare and integration process is also probably key to prevent abuse. So another question that I have is that, correct me if I'm wrong, but my understanding is that the at-home ketamine model basically wasn't possible prior to COVID, because there's this thing called the Ryan Haight Act, which says that if you're going to give someone a controlled substance, they basically have to come and see you in person, right, before you can prescribe it. But they suspended that during COVID. What happened? I've been sort of kind of following the talk around this legislation. Is this going to be sort of like a permanent situation, or is there a risk that, once COVID is done, that law goes back into effect and then the at-home ketamine model is kind of threatened from that regulation?
Yes, it's a great question and a great insight. So just to be clear, the the at-home delivery model was possible before before COVID and before this exemption to the Ryan Haight Act. So what you're focused on is that ketamine is a Schedule 3N drug, which means it's non-narcotic, and it's at the same level as Adderall in terms of being a controlled substance, or sort of coding Tylenol 3 with codeine. That's what we're talking about. And so yes, there's before COVID and before this exemption, you needed to meet in person with a doctor, and telemedicine wasn't allowed. But then you could receive the ketamine at home or take it with you from the doctors. So just to be clear, it's not, even if that were to change, what that would require is an inpatient meeting with a doctor, which we think really limits accessibility. And there's no data that shows that, an inpatient consult is any better than a telemedicine consult. And again, I'm all about the data, and that's what the data shows. What we've seen during COVID is this huge digital adoption, right? That it used to be before COVID, 15% of purchases were done online, and now it's something along the order of magnitude of 30%. And so the same way we've seen in retail, this huge acceptance of digital adoption of the online model, we've seen it in medicine, with teletherapy becoming hugely, valuable. And the reality, I think, hopefully legislatures will understand that, if you're living in a small town in rural Iowa, you just don't have the ability perhaps to drive X amount of time to go see your therapist. And so our view is, we have contingency plans if the Ryan Haight exemption is for, whatever reason, stopped, and our patients are forced to meet with their medical practitioner in person. We have contingency plans. We think that's a tragedy in terms of the amount of people who will not be able, because they just aren't near a practitioner, to go see a practitioner, and obviously the costs will go up. So we have not heard that that exemption is likely to be overturned anytime soon. We've also heard that there's no sort of movement in Congress to make the exemption permanent. So, again, I guess where we started, be here now. We have a business model where we're helping people today. We're very cognizant that, we may have to evolve our business model, and we will. But what we're really focused on is, how can we help those 1 million patients before psilocybin becomes legal? And,
For sure.
The Ryan Haight exemption is a key element to allow us to accomplish that.
So you mentioned just now psilocybin becoming legal. Is there a way that under Oregon's Measure 109, you could potentially offer psilocybin at least to people that are in Oregon?
Yeah, that's a great question. So, today and this goes to a little bit, accepting compromise to do as much good as you can, rather than sort of trying to, uh, be an absolutist and potentially do less good. So, we early on made a strategic decision that we're a mental wellness company. We're not a mental crisis company. Um, and even though we know that these therapies, again, ketamine, MDMA, psilocybin, could be of enormous use to people in active mental crisis, we just realized that um, a negative outcome could really, set the industry back and, set our company back in a huge way. So we decided to really focus on mental wellness as opposed to mental crisis. Similarly, our rigorous, sort of data capture approach, analytics to constantly be refining the protocols and measuring patient outcomes, et cetera, is equally applicable for ketamine therapy, underground MDMA therapy, underground psilocybin therapy, et cetera. But we aren't offering that through our platform today. There's two initiatives that we're hoping to roll out in 2022. One, sort of a private label of our technology for professional mental wellness practitioners who are dealing with patients who are in mental crisis. So essentially, basically offer it. And this is what's nice being a public benefits corp. We can make these decisions without feeling like we have to maximize our income. So we want to give our tools away to practitioners who are on the front line dealing with mental crisis, and then just sort of say, hey, this is a tool that you're using. We really aren't involved. We're not, we don't have an economic model here, and we're just going to give you these tools because we want you to do the most good you possibly can with these very, these patients who are in crisis. That's one. And then the second thing is making these tools available to either underground practitioners or practitioners who are in places where they can work with other medicines under the local law, notwithstanding what federal law says. And again, our view there is, as a public benefits corp who's trying to really focused on social impact, we want to get these tools out to the people who can really leverage them the best, but also recognize that we, as a company in this space, we have to be very careful to stay in our lane, right? So it's almost, one of these balancing acts where we realize we can't be all things to all people. And for us to really accomplish our, the social good and our social mission, which is to help these 1 million patients, we have to actually limit the number of people that we focus on. But again, since our technology can have, sort of a broader footprint in terms of people it can help, we're going to start giving our technology or making it available to practitioners with different focus.
No, I think that makes a lot of sense, right? Because you're giving them the tools, you can still collect the data, and then when psilocybin does become, federally approved in some manner, then you already have some data related to, what it's like to work with psilocybin and all that, and you're kind of like ahead of the
Exactly.
game a little bit. So yeah, very very smart. I like that. Well, Juan Pablo, I don't want to take up, too much of your time. I think we've been going for almost an hour. What does sort of the future of Nue Life look like? What should people sort of look forward to in the next coming months? And, where can people find you online if they want to potentially, begin their mental wellness journey with you guys?
Wonderful. Thanks so much. So we're currently operating in Florida, Texas, California, Colorado, and Washington. We're launching New York by the end of the year and 10 more states before the end of February 2022. So we're currently able to help about a third of the US population. And by the end of February, we should be able to help and service over 50% of the population in the United States. That's sort of our near term in terms of our footprint. In terms of our product, I think we've already talked about it today. We're offering 1 month, 4 month mental wellness programs, but that are sort of ketamine centric. Where we're headed in the first quarter of 2022 is to roll out the 6-month mental wellness program, where the ketamine is the start of the conversation for the first sort of 30 to 45 days. And then the other 4 to 5 months is really about integrating that experience, creating community and connection online through these tools that I mentioned, including the digital phenotyping, all this passive capture of information to help patients, stay well, not only get well, but, stay well, and then ultimately become members in our mental wellness program. So that's really, where we're headed. Our goal last year, or in 2021, was to help 1,000 patients. We're going to help 2,500-ish by the end of the year. Our goal for 2022 initially was to help 5,000 patients. I think we'll be able to have helped 10,000 patients by the middle to, sort of 3/4 into the year, and then just, see how we, scale from there. So, we're making big steps towards our ultimate goal, but, we need to accelerate and grow faster our impact, not necessarily, our revenue. So really, really focused on keeping the social mission. And then the last thing is, quite honestly, as 80% of people in jail for drug crimes are people of color. In cannabis, less than 1% of the legal cannabis industry, the value of the legal cannabis industry was captured by people of color and women. And so, one of the things we're also trying to do in this space is, build a company as a public benefits corp with a different mission than other companies in the space. And also a company that sort of was built by people who look and have different life experiences than many of the people, who are in this space. So trying to also, be pioneers and inspire other, founders of color and non-traditional founders to get involved in this space is really, sort of a key goal for us in 2022.
I dig it, man. Well, you guys have a lot of, exciting things coming up. And I forgot to mention earlier, but I did attend your guys' opening party for Wonderland in Miami. And that was a pretty amazing party. And so I can't imagine what the next party is going to look like when you guys have accomplished some of those big goals that you've set out for the next year. I'm excited. I think if you
Well,
watch the after movie that you guys posted on, I think you see my face in there for like half a second. So there's proof that
that's amazing. Well,
yeah.
as the mayor of Miami says, what happens in Miami never happened. So as far as I'm concerned, that party never happened.
Fair enough. Awesome, man. Well, hey, thank you so much for your time. And I look forward to doing this again sometime in the new year.
Perfect. I appreciate you, Bram.
All right. You have a good rest of the day.